So for next up, we are looking at the aspects of social history taking. So a woman has come to your hospital, so you are trying to ask her some questions. So inside these questions, you are saying you should actually ask for her social history. Now, social history is how she's actually living her life. Is she abusing drugs? Is she drinking? Is she smoking? Do you understand? So the answers you get will help you make a lot of decisions in her favor. Okay? So taking a social history is very important in obstetrics and gynecology. So it provides context about a patient's lifestyle, the type of environment they live in, and if they are getting support from family and friends and also the partners or not. Okay? So why does it matter? It identifies risks, okay? If later after the childbirth the baby will be having issues, or the mother will be having issues. It accesses support systems, potential barriers to care. It guides counseling, referrals, and holistic management. It helps to tailor care to the patient's cultural and socio-economic backgrounds. So in this history, you are trying to know your patient better. Okay? So key components of social history is the type of work they do. Okay? Are they on leave now as they are pregnant, or are they still going to work? Their work-life balance, and health. So living conditions, you are trying to look at their housings, you are trying to see if they have access to clean water, okay, clean environment, good food. Alright, you are trying to see if their environment is crowded. Then marital and relation status, you are trying to see if they are married, and also trying to see if their partner is supportive or abusive. Okay. Education levels, you are trying to access their literacy level. Substance use, you are trying to see if they abuse alcohol, if they abuse drugs, if they smoke. Okay. So of course there's a whole lot of effect on fertility and pregnancy. Okay. Their cultural and religious beliefs, you are trying to look at what do they actually think about this whole pregnancy thing. So sometimes you just ask that question and you sit back and laugh at, okay, how people look at pregnancy. Okay. Financial status, you are trying to see if they have the transport to always keep coming to the hospital. So you can look for other ways in which you can be attending to them, like virtual meetings. They're also trying to see if they can be able to afford the drugs they are prescribing, or you're just prescribing and the patient is going to go and keep it elsewhere. Okay. The support systems, you are trying to see how their families, are treating them, communities, friends. Emotional and practical support during pregnancies or illness. So these are the various things you are looking at under social history as far as obstetrics and gynecology is concerned.